The Influenza Vaccine by Hannah Black, Rachel Chavez, and Maria Lopez Lorenzo. In this presentation, I will be discussing the flu vaccine, including the different types of flu vaccinations, how the vaccine has an impact on society, why some nurses refuse the vaccine, and other general information about the influenza vaccine. The influenza or flu vaccine protects against the four most common flu viruses during the flu season. This vaccine changes every year, and the protection from the flu vaccine depends on the person's age, health, and how similar of a match the virus that is in the vaccine compared to the virus the person may get if they get the flu. Each year, the flu season causes many illnesses and even deaths. There are different types of the flu you can get. When the flu shot is given each year, the vaccine that is used is the one for the strain believed to be spread around the most. How the vaccine works. There are 6 different influenza vaccinations available. The first is an egg-based adjuvanted flu shot, which is recommended for anyone 65 and older. The ingredients in this vaccine helps create an even stronger immune response by being made with adjuvant. An adjuvant is an ingredient used in vaccines to make a stronger immune system response. The second vaccine is an egg-based live attenuated flu nasal spray vaccine, which is available for people through 49 years old and is made with a live weakened flu virus. The third vaccine is an egg-based high-dose flu shot that has 4 times the antigen than the other standard dosages, which will help your immune system be stronger against the flu virus. The fourth is a standard dose flu shot. In this vaccine, the manufacturer will use the live virus in an egg, and there are several different brands that will administer this dose. The fifth vaccine is a cell-based flu shot. A cell-based flu shot is when the virus is growing in a cell culture and is completely egg-free and can be administered to anyone 6 months and older. The sixth and final vaccine is a recombinant flu shot, which is also egg-free and is made from the flu virus, which contains 3 times the antigen than other standard dosages given. The influenza vaccine impact on society. Getting the influenza vaccine is the most effective way to prevent infection. The influenza virus causes illnesses and death all countries around the world. Healthcare workers have an increased risk of infection due to working closely with infected patients. This includes staff besides medical providers such as janitors, cleaners, cafeteria workers, social workers, and many others. Age and health status are factors that contribute to the risk and severity of infection. A quote from the CDC says, during seasons when flu vaccine viruses are similar to circulating flu viruses, flu vaccines have been shown to reduce the risk of having to go to the doctor with flu by 40% to 60%. The vaccine is the best way to prevent infection, but is not guaranteed. Although the vaccine is not 100% effective in preventing infection, if someone who received the vaccine and is infected will have less severe symptoms and will not last as long. This is a quiz question that was created based on information mentioned in this presentation. The question is, why is it recommended to get the flu vaccine every year? The options are A, I was told to do so. B, it's required for work or school. C, the virus mutates often and a new vaccine is developed every year. D, if you get the vaccine, you will not get the flu virus for the season. The answer to why it is recommended to get the flu vaccine every year is letter C. The virus mutates often and a new vaccine is developed every year. The reason is this. The influenza vaccine protects against the 4 most common flu viruses during the flu season. This vaccine changes every year, and the protection from the flu vaccine depends on the person's age, their health, and how similar of a match the virus that is in the vaccine compared to the virus the person may get if they get the flu. For more information on this, You can always visit the website below. Although the vaccine is recommended for all healthcare workers, there are nurses who choose not to receive the flu vaccine. Research had concluded that nursing staff was the cause of the virus outbreak due to not having the vaccine and easily getting sick. The American Nursing Association has endorsed mandating all the healthcare workers to be vaccinated, but has also continued to support the nurses if they refuse receiving the vaccine. By demonstrating an effective way in understanding the epidemiology of influenza virus can enhance the rate of healthcare workers to voluntarily receive the vaccine. More to know. A quote from the CDC says this: during 2019-2020, the last flu season prior to COVID-19 pandemic, flu vaccination prevented an estimated 7.5 million influenza illnesses, 3.7 million influenza-associated medical visits, 105,000 influenza-associated hospitalizations, and 6,300 influenza-associated deaths. This information, based on research, shows how the vaccine prevents infection, medical visits, hospitalizations, and even deaths. This concludes our influenza vaccine presentation. Below is our listed references for the slideshow. Thank you.